Hello, I'll be talking about the effects of radiation in pregnancy, basically, the effects of radiation on the fetus or the embryo. And as we know, from 0 to 9 days, we have the pre implantation phase where the implantation, and from 9 days onwards until 6 weeks, it's the organogenesis where the organs are being formed, and 6 weeks onwards, it's the fetal period until the term. Now, so from 10 days to 26 weeks is the sensitive period. Here is where, if there is exposure to radiation, where there is maximum effect seen. So what happens in 0 to 9 days is it's either all or none effect, because it either leads to miscarriage, that is the death of the fetus, and loss of the pregnancy, or nothing happens during this phase. And so it's either the pregnancy will be carried out or it will be aborted itself. Then in organogenesis phase, if there is exposure to radiation in organogenesis phase, because the organs are being formed here, you will see congenital malformation and IUGR, like intrauterine growth restriction. Now, beyond 6 weeks, here in the fetal period, you will not see malformations. As you have seen in organogenesis phase, if there is radiation exposure during the fetal period, you will not see malformations. You will see growth disturbances from 6 weeks onwards until the term. So if there is radiation exposure, but from 10 days to 26 days is the most sensitive period. Now obviously, from the 9 days onwards until the term, whatever dose of radiation, either it's minimum and the maximum is going, it is obviously there is a risk of carcinogenesis happening with that dose of radiation. Now, coming to the doses of radiation, yeah, that is important to us. More than 10 to 19 centigrade of exposure leads to microcephaly during the sensitive period. Now, from like to the dose of 10 centigrade, you can expect cognitive decline, also mental retardation. If there is a dose more than 10 centigrade exposure, then you have to discuss this with the patient and the attenders to consider therapeutic abortion, because of the known effects that are seen, like congenital anomalies, everything. Now, the maximum permissible dose is 5 millisievert. For per month, it should be, the maximum is 0.5 millisievert. Now, with one centigrade increase of exposure, there is a relative risk of carcinogenesis by 40%. 6% per grade is the absolute excess risk.